It is my pleasure to introduce our first speaker today. So Dr. Chao Shi is currently an assistant professor in the Binghamton University. So she's with the Department of System Science and Industrial Engineering. Her research focus covers the broad areas of vehicle behavior, autonomous driving, healthcare and performance prediction, situation awareness, and cognitive and mathematical modeling. Okay, so with that, I'm gonna give the stage to the speaker. So let's welcome our speaker. The system is warming up. It's a little bit cold. Yes, sir.
So hello everyone. Thank you for joining the seminar today. So I want to firstly thank Dr. Tong and the department for arranging this seminar. I'm very happy to be here. So I like the Delaware a lot. I arrived last night, and I think the street view is pretty nice, the countryside style. I like it very much. So as introduced by Dr. Tong, I'm an assistant professor from Binghamton University. So I have a background in psychology and industrial engineering. So I'm currently in the system science and industrial engineering department. So today I will give a talk about one of my recent research. So it's still ongoing research. It's about the clinical, motor, cognitive, and takeover performance in the conditionally automated vehicles. It's a study of the health of the healthy and the concussed individuals. So firstly, I would like to introduce some of my research interests. So broadly speaking, I do research in three main areas. So the first area is the autonomous driving in healthcare, which is a topic that I will cover for today. So for example, we have big research team in Binghamton. So we collaborate with clinicians in the UHS. And we also collaborate with the psychology professors in the psychology department, of course, and also collaborate with some motion analysis experts in the nursing department, and also myself. Okay. So we collaborate to evaluate the concussion drivers' performance in the CAV environment. So by combining our expertise, we compare their performance in various domains, like the clinical and some like the balance, their gait analysis, and etc. So our goal is to create a guideline to help the clinicians and also the drivers to go back to the driving safely. Okay. And another focus of my research is in smart manufacturing. So I have done several projects and publications in this area. So for example, I have monitored the operator's performance in a smart manufacturing environment. So we designed several layouts of the interface that they will be monitoring during the task. And we also designed the way that they will display the abnormal situation gauges. So by doing this research, we were able to find that the layout of the interface and also the way we deliver the information to the operators to detect the abnormal situations will significantly affect their performance, like the response time and also their accuracy in detecting the abnormal situations. And also we create a model to predict the operator's cognitive workload when they are in the smart manufacturing environment. By conducting this experiment, we found that when the operators are detecting abnormal events, their cognitive workload will significantly higher than when there's no abnormal events happening. So by conducting this experiment, this research, we hope to give some like insights or lay some research foundation for future researchers if they want to like adjust the operator task loads when they are like overloaded. And lastly, because my background is in psychology, so a major part of my research is still in the area of cognitive science, cognitive psychology, or like you call it cognitive engineering. So many of my research focus on the situation awareness, the cognitive, like human cognitive behavior, and we also created mathematical modeling. So for example, in one of my research projects, we use the eye movement, like human eye movements, like fixation saccades, to evaluate the situation awareness scale. So the scale we evaluated is called SART. So it's a scale that can subjectively measure human situation awareness after they perform a task. So because the eye movements can indicate human internal states, and we use the eye movements to evaluate this scale, and we found that because the scale has like 10 questions in total, and four of them were found to actually confound with the cognitive workload factor. So that means this scale is not accurate when they are when we use it to measure human situation awareness. So by doing this research, we want to give some like inspirations for researchers who is in this area, and we aim to like revise this scale. And another part of my research is we created and validated a situation prediction model. So we create a model to predict the detection of abnormal situations of the operators in the smart manufacturing. And we found that the model can be used to alert the operators if they didn't like catch or detect abnormal events in time or immediately. So this model can be used to like reduce the possibility of making errors or miss any like signals in the manufacturing system. And later we also validated this model. We generalize it to various populations. Like we proved the accuracy is still high when we apply to like the older adults and younger adults. And we also generalize this model to different task loads, like the high task loads and low task loads. And lastly, because the touch screen is more and more used, so we validate that this model can be generalizable to like the operators who use touch screens versus those who use the traditional mouse. So in today's talk, I will talk about the autonomous driving in the healthcare, which is one of my main research focus now. So first, I want to talk about the prevalence and the impact of the MTBI, so which is concussion. So it has been found that the MTBI or concussion, they affect 50 to 60 million individuals worldwide. And of them, 1.6 to 3.8 million cases were occurred in US annually. And this number accounts for 85% of all the TBI cases. So the TBI has mild TBI, moderate TBI, and severe TBI. And the concussion, the mild TBI, accounts for about 85% of all the cases. So which is like a very large portion of all the cases. So a lot of evaluation measures have been used to like evaluate and assess the concussion. And most of them are still from the clinical assessment perspective. Like they are like symptom inventories, computerized neurocognitive tests, and like oculometer tests, the balance performance tests, and also like the single task and dual task tests. So these tests can help determine the extent of impairment and guidance and give some guidance to the clinicians and the patients, like if they're ready to resume like the daily life. Okay. So we found that the individuals with concussion, they have some like long-term driving behavior impacts, including like the increased abandoned driving behaviors and the accidents. But there are currently like not much research on on this area, except for some research on the concussion drivers in the cars without any automated features. what are the challenges in recognizing the concussion driving difficulties? So one main thing is from the imaging. So for concussion patients, they normally go through the structural neuroimaging techniques, but it's hard to find any structural changes like from the CT or the MRI. But the concussion drivers still face a lot of cognitive challenges. So for example, they may have like motor and cognitive deficits, and these deficits persist even after the clinicians told the patient that, okay, you are ready to go back to your daily life, you are like safe, you are healthy now. But these deficits still persist, which leads to increased driving difficulties. So for example, they may have increased frequency of aberrant driving behaviors. They may have higher rate of rule violations and also higher number of car accidents, which may affect the road safety. And the previous data also support that the concussion drivers, even after like 12 or 24 months after the injury, they still have like worse driving behavior than the healthy controls. So during the driving, the concussion drivers, they may have some symptoms like fatigue and reduced concentration, which is like they self-complaint. So this can obviously may affect their driving behavior. So that's the reason why the conditionally automated vehicle, it could be a solution to this problem, because the CAVs, they can like reduce the cognitive and motor workload of the drivers in many cases, which may reduce the possibility of having any like traffic accidents. So for the CAV, it has the driver assistance technologies to like to drive autonomously. But since it's conditionally, it still requires the drivers to take over and start manual driving in high-risk situations when the autonomous system reaches operational limit and fails to respond to the situations. However, for the current research, there's not much in the like autonomous driving field, and there's like no like driving evaluation before the concussion patients go back to their daily life. So in words, there are currently no guidelines to assess if a driver with a concussion is fit to resume driving in a CAV environment. So in the CAV, they have the ADAS, the Advanced Driving Assistance System. So the ADAS, they have features to provide commands for like lane changing, the danger and hazard alerts, and other like tasks. So these features can allow drivers to focus on monitoring the driving environment, and they can like focus on some like non-driving related tasks, the NDRTs. Like one example of the NDRTs could be like they can send a text message when they're in the CAV, when the car is driving autonomously. And also they can like maybe talk to their friends on the phone. And if you have seen like some Tesla news, some drivers just sleep in the car. Okay, so that's also NDRTs. So the CAVs will combine the automated and the manual driving capabilities. And it will require the drivers to take over transitions and the manual driving. And the takeover and the transition, this takeover transition from the automated to manual driving in CAVs, they will present challenges in the even for the general population, like for the healthy controls. And needless to say, for the concussion drivers, because the concussion people, they have, like we just said, they have cognitive and motor deficits, while the manual driving, while the transition requires a coordination, an efficient coordination between their cognitive and motor abilities. So this may impact their takeover performance. So for the takeover performance, so takeover performance is one of the main measures in the CAVs for the human behavior measurements. So we found that the drivers with concussion, we think the drivers with concussion, they may have like longer takeover times and worse takeover quality. So like they may have like increased failure rates during the transition from the automated to the manual driving in the CAVs. And also from the previous research with the cars that have no automated features, we found that the teenager drivers with concussion, they have like about 3 times higher fatal crash rates than the hazard controls. That means we need to like understand their driving challenges for the teenagers and maybe other age group as well. So from this previous research, we can see that there's a lack of information on the motor and the cognitive deficit effects on the takeover performance in the CAVs. The main information we get is that we have a lot of subjective complaints about their driving competency. So therefore, in the current research, we will do a longitudinal evaluation of the concussion drivers. So we will evaluate their, we will do an assessment of them 1 week after the injury and 2 weeks after injury and 1 month, about like 2 weeks to 4 weeks to a month after the injury. So we evaluate their symptoms and their recovery progress. And moreover, we will also recruit healthy participants to serve as a control group. So through this project, we want to quantify their recovery. So by doing the experiment, we could provide some like measurable data on the concussion drivers' recovery progress by comparing the concussion patients themselves from the 3 visits, and also by comparing between the concussion and the healthy controls. Okay. Like here, we will evaluate their relative performance between these 2 groups. And then we can create a guideline to help inform decisions regarding the return to driving after the concussion. So next is the innovation impact. So currently, the most of evaluation still rely on the clinical assessments. Okay, so like most of the patients, they just go to the hospitals and then they do like a series of clinical evaluations, and then if they have like the mild TBI, it's likely that they're told that you have made enough improvements, but actually you are still have some like residual deficits. So these clinical assessments doesn't evaluate the functional performance in everyday life, like the driving, also like when you work, they don't like evaluate enough. Okay. So there are some like potential cognitive and motor difficulties, okay, that these clinical measures cannot capture. So that's why we want to like measure the motor and like other physiological parameters to have a better understanding of the phenomenon. So for the driving, we can see that we already see that they are like the cognitive and the motor deficits that will cause difficulties while driving, and also this motor and this cognitive and motor deficits, they make longer the reaction times and also affect their decision making, especially when the driving situation is in high stress. Like if the traffic is too heavy, and the autonomous system may not be able to like respond immediately. Okay. Specifically, like the takeover timeliness, which is one of our interest parameters, the takeover timeliness may be affected by the symptoms of the concussion drivers, and also their takeover quality may also be affected by the concussion symptoms in the CAV environment. So therefore, in the current research, it's important to identify the potential cognitive, clinical, and motor factors that associate with the takeover performance in a CAV environment. And therefore, we can establish guidelines, like by integrating the, identifying the factors, we can find a way to like create a guideline for the concussion drivers to return to the driving safely. So currently, the concussion drivers is normally like go back to driving like within 7 days or 14 days after the injury. So which is actually very dangerous to the safety. Okay. So that's that's our project's goal. So we can increase the safety on the road. So next, so what is the issue here? So for the current research, we focus on the teenagers and the young adults, like from 16 to 24 years old. So as you may know, like the concussion is not the only population that have motor and cognitive deficits. Okay, so there are many populations who have like some like cognitive impairments or like motor impairments. So in the long run, we want to extend our research to find easy and measurable clinical metrics to help identify the driving impairments for those who have like general like cognitive and motor deficits. And in the future, we want to use the like real-time sensors to diagnose the cognitive motor ability deficits for drivers in a safe environment, so that we'll be able to detect if there's any potential danger, there's any potential factors that may affect the safety on the road. So therefore, in this experiment, we will integrate these findings. Okay, so we will integrate the findings between the concussion and the healthy drivers, among all the clinical measures, the motor measures, the cognitive measures, and the Takeover performance from the safe environment. So our research will lay a foundation to provide valuable insights for the clinicians and the drivers who have like motor and cognitive deficits in general. And then we want to enable informed decision regarding safe return to driving for not only concussion, but also the patients who have like motor and cognitive deficits. So our team has done some previous research. So we found that for the adolescents with concussion, their gait velocity is significantly different than the people who doesn't have concussion. So specifically, they have a significantly slower gait velocity than the healthy controls. And also we did a research about the young adults with concussion. And we found a significant difference between the concussion and the healthy controls in the dual task walking. So specifically, the young adults with concussion, they have significantly longer dual task walking reaction times than the healthy controls. So these previous findings demonstrate the effectiveness in differentiating the motor performance in concussion and also the healthy controls. So next is the study overview. So for this study, we have already finished the pilot study, and we measured the human's gait velocity during the dual task conditions and also their takeover performance in the AV environment. So we found that the concussed individuals have a higher reduction in the gait velocity during the dual task conditions, which is consistent with the previous literature. And also we found that for the takeover performance, the concussion patients had significantly lower takeover success rate than the healthy controls. And also we measured their SPM, the situation presence assessment method. So SPM is a method to objectively measure human situation awareness during the task. So for example, we will ask questions like, how many cars are around you? And also, what is the color of the car that just passed by? So by asking these questions, we'll be able to know if the participants had enough like perception and understanding of the situation around them. And we found that the concussion individuals, they have longer response times and reduced accuracy in SPAM. So that means like for every question we asked, they may have like longer response times to like answer the questions. And we also measure their pupil diameter, their saccade and fixation durations. So we found that there are like significantly higher pupil diameter, saccade duration, and fixation duration for the concussed group compared to the controls. So that means the concussion group may have a higher cognitive workload, more information processing, and they need more attention to finish the task than the healthy controls. So power analysis. So because the takeover time is one of our primary interesting factors, so we use a TOT to calculate for the power. And based on the prior power analysis, we found that to reach a power of 80% with an effect size of 0.23, we need about 28 participants to reach to like complete this experiment. And because they're like potential dropouts, and there could be some outliers, and in some cases we have like perfunctory participants, like they may not pay attention to the task, or like they may like fell asleep during the experiment. We have this situation before. So we aim to recruit 30 participants for the study to ensure we have enough power. Okay. So our central hypothesis is that the concussion drivers will demonstrate persistent clinical cognitive motor deficits and worse takeover performance. And our objective is to evaluate the longitudinal changes in the clinical cognitive motor and takeover performance among the teenagers and young adults with and without concussion. So our first aim is to quantify the concussion drivers' clinical motor, cognitive, and takeover performance up to 1 month after concussion. So for our first aim, we have two hypotheses. So the first hypothesis is that the concussion drivers will exhibit worse or the worst performance in their initial visit, but they will like improve steadily for their sequential 2 visits. And the hypothesis 2 is that we hypothesize that the takeover performance for the young adults with concussion will be strongly associated with the gait, the cognitive, and the eye tracking measures. So to reach the power, we will recruit 15 participants from the concussion patients, and they need to be aged from 16 to 24 years old, and who were diagnosed with concussion like recently. So we have like a strict inclusion and exclusion criteria. Like if this patient who diagnosed with concussion, they were diagnosed with another concussion like within 6 months before this new concussion, they cannot be included in this experiment. Okay. And also if they have like some like specific or like special medication like conditions, they will also be excluded from the experiment. So from one of the previous research, we found that the male and female, they have significantly gait velocity after they have concussion. So in this experiment, we will try to recruit a balanced number of male and female participants. So evaluation timeline for the concussion patients is 7 days, 2 weeks, and 1 month after concussion. Okay. So the diagnosis will be conducted by the sports medicine physicians who collaborate with us at UHS. So they will diagnose the concussion consistent with the international consensus guidelines. And if the patient is like meet the criteria, and also they are interested in participating in the experiment, the clinician will send the participants to our lab, and then we will do the next experiments. So the assessment is sequential. So firstly, the clinicians will diagnose the patients, and then if they're like if they are good candidates and they are willing to join, then they will go to our lab to do the motor analysis, to do the motor tasks. And next, we will do the cognitive tasks. So the cognitive task is combined with the driving task. So we measure their cognitive abilities during the driving task. And also after the driving experiment, we will perform another cognitive task that is specifically designed for the driving abilities. So as you can see, we have comprehensive assessment battery that can understand the post-concussion conditions. Like we can evaluate their concussions from the patients, from the physician's perspective. And also they can like self-evaluate their symptoms from physical, cognitive, and behavioral perspectives. And also we can investigate their like balance, vision, and like movement. So approximately based on our previous data, it takes about 30 minutes to do the clinical assessment and 150 minutes at Binghamton University's research lab for the other motor, cognitive, and the driving tests. And also, again, we have 3 tests in total. So here's the experimental protocol of both of the aims. So for the first aim, we will do a longitudinal change in performance for the concussion patients. So you can see here, the time 1 is 7 days within concussion, and time 2 is 2 weeks within the concussion, and time 3 is 4 weeks within the concussion. So these are the assessments that all the concussion patients need to perform. So for the clinical evaluation part, as you just say, we have the SAT6, the RPQ, and the VO-MS. So these are the clinical assessments that can evaluate the severity of the concussion. So this neurological and provocative tests can help assess the neurological function and the symptoms to help the diagnosis and the treatment of the concussion. And also, the kind of evaluation will include like the mental status, visual acuity, and balance. This assessment will help us have a better and a more comprehensive neurological assessment. And next, when they were sent to our lab, they will first do the steady balance task for the motor part. So we will use a post-radiography system. Okay. So the participants need to stand in this computerized dynamic post-radiography system. So the system has an immersive virtual environment and 3 reference force plate. Okay. So the participants need to complete like 6 conditions in the system with trying their best to stand still and keep balance. So for example, they will stand still with their eyes open or with their eyes closed, or they may with their eyes open, but the visual surroundings will change like continuously. And they need to try very hard to still keep balance, okay? And for the measurement, we will analyze the central pressure. We will measure the use of hip or ankle stretching, and also the amount of sway across all the 6 conditions.
Question.
Okay. Yeah.
Driving, you sit to drive.
Yeah.
So why standing matters?
So yeah, so that's a good question. So we think the motor and the cognitive deficits, they may affect the driving performance. So for the motor analysis, we will do like a comprehensive analysis of their motor ability. And also when in the driving task, which I will talk about later, we will also measure the like muscle activities during the driving. That makes sense. Yeah. So I know like some of the motor analysis may not look so directly related to the driving itself, but it's like measuring their like problems, like fundamentally. Thank you. Yeah, thank you for the question. Yeah. So next we will measure their like gait analysis. So we have the reflective markers in the lab, and we will do the motion analysis. So the reflective markers are used to like capture the 3-dimensional trajectory, and we will also use the motion analysis system to record their gait at a comfortable walking speed. So the patient will like walk for 10 minutes long at their like comfortable walking speed. Okay. So the analysis will include the spatial temporal gait measures and also their balance control during the single and dual task walking trials. So for the dual task walking trials, the participants will perform the verbal fluency tasks while walking. So the verbal fluency task is like we will ask the patients to name as many words as possible that start with letter A as they walk the 10-meter long. Okay, so we use the verbal fluency task because we don't want to have any interference with the visual attention during the gait analysis. So next, we will assess their cognitive ability. So the first is the SPM that we have just talked before. So it measures the situational awareness of the participants when they are doing the driving task. And also another TLX measures their mental workload in 6 dimensions, like their performance, like their physical workload, and etc. So these two, so the SPM is conducted during the driving task, and the NASA TLX is conducted after like the driving, after the simulated driving task. And we also measure the eye tracking during the driving task. Like we measure the eye gaze behaviors, like the pupil diameter and blink number. Because we choose these parameters because they can indicate the driver's cognitive workload during the driving simulation tasks. And after driving task, we will do a DAB in cognitive. So DAB is a digital neurocognitive assessment that can measure the cognitive abilities that relate to driving. So for example, for driving, like the reasoning could be, or like short-term memory could be an important cognitive ability for driving. So the DAB is a comprehensive battery that measures the cognitive abilities that is specific related to the driving. So for the driving simulation, we use the OpenViewer Gen 3 simulator. So the participants will sit in this driving simulator to conduct the experiment. And during the experiment, we will collect their EMG data. So the EMG data is used to collect the muscle activity. So we will place EMG sensors on the specific muscle groups. So as you can see here, the white balls, if you can see it. So we place the sensors on their like arms, their legs. We place about like 12 or 13, I forgot the exact number, but like various parts of the body to measure the muscle activity during the driving. And also the takeover performance. So we will evaluate their timely and quality responses during the takeover events in the simulated autonomous driving environment. So to make sure that our evaluation is comprehensive and increase the reality of our experiment, we designed several scenarios, like the crash events, the challenges in maneuvering, and the false alarms, to comprehensively evaluate the driver's response in different like life scenarios. And for the takeover performance, we will measure their timeliness and quality. So these are the primary measures. Like we will measure like the speed, the acceleration, steering, and the clearance statistics. So for the statistical analysis, we will do a comprehensive statistical analysis, and here's part of the plan we have for now. So because they have 3 visits in total, so the first visit will be used as like baseline visit analysis. So we will summarize the concussion participants' characteristics and their clinical properties during the baseline visit for the initial assessment. Then we will fit the model, and then we will fit the model to like the second and third visits. And moreover, we will use regression models to explore the factors that can predict the takeover timeliness. And because there's like so many factors that we manipulated, so we will use like lasso or ridge regression to select relevant variables. And moreover, we will use unsupervised clustering to identify any like latent groups that may show differences in the motor, cognitive, and takeover performance. And also we will measure their correlation with the self-reported symptoms. So our second aim is to compare the difference in the clinical motor and cognitivity, as well as takeover performance between the concussion and also the healthy drivers. So for aim 1, we focus on the concussion drivers only. And for this second aim, we will compare them with the healthy drivers. So we hypothesize that there will be learning effects for all the 3 visits for both groups. So we hypothesize that both the concussion and the healthy drivers, they will show some steady improvements over the 3 visits. And moreover, the concussion drivers will be consistently worse than the healthy controls in their clinical, motor, cognitive, and the takeover performance. So the inclusion criteria for the healthy controls is similar to the concussion patients. So we want to pick the age and their maybe degree to be consistent, so that we can increase the comparability. And also for the exclusion criteria, if they are healthy controls, but they have been diagnosed with concussion recently, they will be excluded from the experiment. And also, if they have specific medical conditions, they will also be excluded. So we try to set up like a rigorous criteria for inclusion and exclusion to increase the comparability between the concussion and also the healthy controls. And also we will balance the gender to again like make the comparability higher. And moreover, we will also evaluate the healthy drivers for 3 times. So because the healthy drivers, it doesn't actually have like a first day of injury. So we will take the first visit at the first day, and then 2 weeks after their first visit, and then 4 weeks after their and 4 weeks after their first visit to to have the like same time intervals as the concussion patients. And we do this also, the purpose of doing this is also to increase the comparability with the concussion drivers. So we will assess it similarly. So we will evaluate their clinical, motor, cognitive, and technical performance to provide a comprehensive analysis. So we will do longitudinal linear mixed effect models, so which will be utilized to capture the performance change over the 3 time points for both the concussion and the control groups. And we will also use like lasso-rich regression to select the variables and refine the models. So the concussion and the health controls, they may have like different selection of variables. So we do the selection for both groups. And also we will do some like exploratory analysis, like in classification and clustering methods to like uncover any like underlying patterns and relationships in the data if needed. So through this project, we hope we can provide some like quantitative evaluation, some like meaningful findings, so we can summarize the findings and and then give some like clinical implications of the study's results on the like clinical assessment and treatments of the concussion. Moreover, we also want to like use our results to give some inspirations and ideas of the drivers, like you are not ready to resume driving, and be careful if you go back to driving immediately after the concussion. Okay, of course we don't want them to go back to driving immediately after concussion. Okay, so we hope that our research can highlight some potential areas for future research. And we hope that our study outcomes can give some like inspirations on future researchers like explorations in this field. And thank you, that's all for my research.
Thank you for the talk. Do you have any questions for the speaker?
For your participants at your testing control, is the exclusion criteria only qualifying the healthy drivers, or is it for both?
Oh, it's for both. Yeah, I have talked about this for the concussion, but like because of space, so I just talk about it like orally without like presenting it. Yeah.
Yes, please.
Is there any specific reason that you choose participant from the age from 16 to 24 years old?
Yeah, so that's a good question. So we actually spend a lot of time discussing the age range. So initially we want to like include like older drivers as well, but the older participants, they may have other like symptoms or disease that like confound with the factors. So, and also many of our researchers, we focus on like the teenagers or younger adults. So we choose this age group as a starting point. But that's a good question because we do want to like, extend it to older adults. Yeah. Thank you.
Any other questions? So I just have a quick question. So in your statistical analysis, so do you focus on any quantitative aspects, so the hypothesis testing or confidence intervals or p-values, or just focus on the qualitative points?
Oh, we definitely will focus on like when you mentioned like the p-values and the comparison between the groups and among their like 3-time visits. Yeah.
Does that require that the sample size to be large enough?
Yeah, so like the power analysis, we need like 30 participants to reach the 0.8 power. Yeah.
Okay, so if you have no questions, then that would be all for today. So let's thank our speaker again.